Hello, everyone. Welcome to the online repertory training course ORTC 2022 by Dr. Ghanshyam Kalatia and team, and myself, Dr. Yamini Ramesh. And today we are going to discuss about how important repertory is and how to solve cases with repertorization and how to use different repertories and how to choose repertory and so many things. I hope you're enjoying the course already and you are also learning through the rubric exercises, the case exercises, and it is a wonderful opportunity for me also. It's a privilege to work with Dr. Ghanshyam sir, and he has given this opportunity. So, sir, I thank you for this, and let's start today's topic. Okay. So I feel that repertory is a very important tool to find out the simillimum. Um, After so many years of practice and experience, I feel that I can't work without repertory in most of the cases. There are some cases which gives you the remedy directly, the simillimum directly, but most of the cases you need repertory. So repertory is a subtle tool to find out simillimum. It gives you the confidence to prescribe the right remedy, and it ensures the cure also with the selection, because the selection has to be perfect. So first of all, I want to show you some of the cases where repertory really helped me, and how one should actually repertorize to find out the right minimum, and then I will tell you how to choose repertory and how to go about repertorization. So let's start. So this is a case of a 26 years female. She had hemorrhoids after delivery, which is very common in women, and she had bad constipation, which was never there earlier. She never had constipation, but right now, when she came to me, it was in 2020, I guess. This case came to me. So this Mrs. NK had bad hemorrhoids after delivery with extremely painful piles, burning, and pain in the anus. 4 months back, she told me that I delivered a baby. This was a full-term normal delivery. And on 21st, she said I delivered a baby. For 10 days, there was nothing. So when she delivered, immediately after the delivery, she did not have any pain. She didn't have piles immediately after the delivery. But after 10 days, this pain started. And burning also. There was a burning after motion. For 5 to 6 hours, she said, after stool, I'm not able to sit, doctor. It's so painful. It's completely, I have to like stand, and I'm almost restless all the time for 5 6 hours. It's excruciating pain. And for last 1.5 months, 1.5 months, it was like that. So my gynecologist gave me some medicine, but there's no change. So she gave some, some anti-inflammatory drugs and painkillers, and that lotions also, local applications, but nothing happened. From last 1 month, I was at mom's place, so little change, because she takes care of the diet a lot, but still the problem is there. So this lady, the main problem of her life was that she has to take care of the whole household. I mean, even after the delivery and before delivery, during pregnancy, she was doing all the household chores, and she did not have any help from the in-laws, from any servant or anything like that. So she was doing a lot of work. So she said, because I'm at mom's place, she takes care of my diet, she takes care of my schedule, but still I am facing the problem, but it's little better. So very hard stool, very hard motion. She said, I have to push a lot, I have to strain, otherwise it doesn't come out at all. Pain is too much, bleeding is happening from 2 to 3 days, bright red colored blood. And she's from Gujarat basically, but she lives now here in my city. So she said, whenever I go to Gujarat, my motions are better, but here in Indore, I'm always constipated. So then I inquired about other things of her life. She said, I'm married for 2 years now, and she was in Singapore earlier, and in March only she shifted to India. During pregnancy also, I got constipation in first month. So for first month, there was a lot of constipation. She consulted a doctor, and they said that, yeah, it's common in pregnancy. But I don't know why it is happening. So after 1 month, she was okay. There was no not much of the constipation. But after delivery, for 4 months, she is in excruciating pain, very hard motion, and this pain is like pricking or stitching. She said it's like chuba hai kuch wahan pe. It's like pricking. And her delivery was normal. The baby was healthy. He was like 3.5 kgs almost. And then she told me that, doctor, I feel this is also happening because I have to feed my baby and I'm unable to sleep properly because, if my sleep is not proper, my digestion gets affected. So I have to like wake up repetitively to feed him. And maybe because of that, my digestion is not good. Lot of work she's pulling off. And she said, my baby is also small. I'm not getting enough sleep. I have to do these household chores. I don't have any help in the house. Husband even doesn't look after the baby. So basically, I am the one who's looking after everything. And she was so weak. There was a lot of weakness after delivery. She said, I get tired easily. And then I asked about her nature, her life situation. She said, I came here in March from Singapore to my city. And then she said that, I was 5 months pregnant. I was living separate from the husband with the in laws. The husband was in Singapore, and in-laws don't talk to this lady. She said they are very reserved. That's why I miss my family a lot. I always feel loneliness. Husband also talks very less. He's also reserved, and that's why I miss him. I missed him in the pregnancy. After delivery also, now the husband is not here, so he went off again to his side. I miss my brother and mom. So in his family, in the in-laws family, there are no bonds. Sharing is almost absent. Husband's nature is very good, but he doesn't talk much. And my lifestyle is also changed completely. I'm trying to adjust, but I'm a frank person. I'm not able to talk much with these people. And there's the sister-in-law who doesn't help her at all. And she said, there's a lot of discrimination my mother-in-law does with me and my sister-in-law. She wakes up at 2 p.m. and my mother-in-law is always upset that why you're commenting on her, why you're doing this, that. So, the typical mother-in-law, daughter-in-law syndrome. And she said, I couldn't cope with them. I was doing all the work. I was cooking all 3 meals. Then I felt that discrimination during pregnancy. I can't express, lack of understanding is there. I expect they should help me, but they are not doing it. I'm emotionally weak. So basically, this is the case. See, to whenever you're solving a case, even if the physical generals or one or two symptoms are very prominent, you have to explore the case, because otherwise, then what happens further is we are not able to differentiate between close looking remedies. So though this case has very prominent physical generals, very prominent, hemorrhoid symptoms, but still, if you only look at one aspect of the case, then differentiation and choosing the exact remedy is a little difficult. So that's why you have to explore everything, whatever you're getting. So then she told me that full pregnancy she was alone. In-laws were there, but husband was not there. And she had desire for spicy food, salty food, pakodi and dal chawal. And she's a very, very chilly patient, extremely chilly. And when I asked about her nature, she said, I was frank. I miss my brother's masti. We used to, we had a very good bond and we were very friendly to each other. But in general, doctor, I worry a lot about things. I'm an anxious kind of person. I have strong fear that if something happens to my health, if I get cancer, this happened and I thought, oh, anus mein cancer ho jayega, aisa ho jayega. So she had strong fear of getting cancer or getting a big disease. And she said, I keep thinking. That means she's an anxious sort of patient. This is my habit, she said. So when we look at the case, when we look at the totality, we get two, three major symptoms. One is the hemorrhoids, which are bleeding, which happened after delivery. Pain is excruciating and stitching sort of pain. This is very important because we know the type, the location, and the sensation of the complaint. Burning, slight burning is there, not much. And patient is extremely sensitive and anxious, which we saw because she is very emotional. Some emotional issues are also going on where, she feels lonely. But we have very clear physical characteristics. And the important thing is the pain is lasting for very, very long time, 5-6 hours. Okay. So I have put everything into repertory. I took, of course, if you are solving the case of hemorrhoids, where you will get hemorrhoids in the rectum chapter. Okay, so go to rectum chapter and go to this rubric called hemorrhoids. And then I took hemorrhoids bleeding, hemorrhoids painful, pain continuous stool long after. So long after stool, like, for 5, 6, 7 hours. Pain cutting, splinter as of, what she said, pricking, chubh raha hai jaise kuch, stitching needles as from, and constipation after delivery, after puerperal time, constipation, difficult stool, fear something will happen. I took the mind symptoms also because they were very clear. Anxiety about future, anxiety about health, because she was anxious, mujhe cancer ho jayega, mujhe kuch ho to nahi jayega. Indigestion from loss of sleep, this is very important because she mentioned repetitively that because my baby is small, I have to look after him, I have to wake up frequently, and that's why I'm my digestion is affected. So indigestion from loss of sleep and hemorrhoids with bleeding, which is bright red color. So what do you think, which medicine will come up? Let's look at that. Look at the chart. So the first medicine which is coming up is Nux vomica. Okay. So what do you think, we should give Nux vomica or we should go ahead? So what I do generally is, I would look at all the prominent remedies and then think uh, about all the remedies from the perspective of nature of the patient or generalities of the patient. So when you look at the chart, you will see that Nux vomica, nitric acid, sulfur, alumina, all are very, very close. Okay, they are covering most of the symptoms. Only one or two symptoms are not there. So then when such type of remedies which comes, it looks like nitric acid a little bit, it looks like Nux vomica, it looks like alumina, but we need to know what it is exactly. So what we need to do, we have to go to the final code of justice, which is materia medica, and read the materia medica. Even if the remedies um, you know seems to be the common remedies or the polycrest ones, still we have to look at the materia medica. So let's read. So see, nitric acid. So person suffering with chronic diseases who take cold easily, what patient said? She was chilly. So we need a chilly remedy. Are easily disposed to diarrhea, rarely to those who suffer with constipation, old people with great weakness and diarrhea, and excessive physical irritability. Pains, sticking, stitching, pricking as from splinters. This is the symptom. Okay, so it is there in nitric acid. Suddenly appearing and disappearing, and gnawing here and there as from ulcers, and during sleep or change of temperature or weather. Okay, so this is nitric acid. And what Alan writes about nitric acid, so after continued loss of sleep, long lasting anxiety, overexertion of mind and body from nursing the sick. So what she is doing, she's not nursing the sick, but she's nursing the young baby. Is the small baby needs a lot of care, and she's also taking care of the whole household. That's why, and also losing the sleep. So it seems like a very close remedy. So after continued loss of sleep, long lasting anxiety, overexertion of mind, anguish from loss of dearest friend, uh, tired of life, and great anxiety about his disease, constantly thinking about past troubles, and morbid fear of cholera, depressed and anxious. So this patient was also had also a lot of anxiety. And hemorrhage from bowels in typhoid, typhus after miscarriage or postpartum from overexertion of body, which is bright, profuse, or dark. So nitric acid seems to be a very, very good match because the bleeding is matching, the pain is matching, the cause is matching. But don't stop here. Go to the other remedies and read them. So let's talk about nux vomica. So nux, you know, the one symptom which one should never forget about nux vomica is frequent ineffectual urging. So they have frequent motions, um, because they feel that, you know, it's unsatisfactory. There is some part which is remained, which is unexpelled, which is not here. So patient doesn't say, you know, I have to go again and again. She said I have to push, but she didn't say I have to go frequently because I feel that kuch reh gaya hai, there is something remaining. So we can easily, you know, and mostly nux vomica has itching and blind hemorrhoids. There is bleeding you would see rarely. Um, Absence of all desire for defecation is a contraindication for nux vomica. So we can obviously just remove the nux vomica from our probable list, because there's the one symptom which should be there is not there, which is frequent ineffectual urging. Now next, sulfur. Sulfur is also very close because sulfur has bright red bleeding, pain, and itching also, but we didn't see any itching in this case. And there is no redness around the ends, right? There is no morning diarrhea. There is no burning, because in itching, in sulfur, there is huge burning. Burning is there, but it is slight. So, what Boric says, itching and burning of anus, piles dependent upon abdominal plethora, frequent unsuccessful desire, hard, naughty, inefficient, and child afraid on account of pain. So, in this case, of course, she has very, very hot stools. Okay, burning is there, but it is a slight burning. The pain is the most important characteristic. So, obviously, we can just remove the sulfur as well. Now, next is alumina. So alumina has very hard, dry stools with almost no desire, which matches with the symptom. Rectum sore, dry, inflamed, bleeding, itching, and burning. And even a soft stool is passed with difficulty. Great straining, constipation, of infants and old people from inactive rectum, and evacuation preceded by painful urging long before stool. But in our case, there is no pain before stool. There is a pain after stool, which is remaining for very, very long time, which is the keynote symptom of acid nitric. So, you know, in this way, our selection becomes very subtle, very sure, and we can easily differentiate amongst the remedies if we study even the physical symptoms of that particular part. Like if you're reading rectum or stool or stomach in these all these remedies, you will get to know that okay, this remedy matches exactly with the symptoms of the case. So obviously the remedy is acid nitric. I gave her 200 after reading all these remedies. And look at these symptoms of boric. Great straining, but little passes. This is what she said, that I have to push, otherwise it won't come out. Rectum feels torn, bowels constipated, fissures. And this pain is because of fissure. She might have internal fissure. We never knew. Tearing pains during stool, violent cutting pains. So stitching pain is the keynote of nitric acid. And after stools lasting for hours. Okay, hemorrhages from bowels, which is profuse. Hemorrhoids bleed easily, diarrhea slimy and offensive, after stools irritable and exhausted, colic relief by tightening the clothes, and so on and so forth. So I gave her nitric acid, and within a week she called me and she felt much better. She did not have pain, no bleedings after a week. Okay, and no stitching pain, no pricking, and stool has also become softer, and she did not have to use laxative at all, which she was using earlier. She was taking some isabgol and some other laxative also on a regular basis, and after using laxatives also the stools were hard. So this was a very it was a simple case, but I just wanted to show you how to differentiate amongst the remedies. So let's talk about the next case. So this case taught me a lot. I'm telling you, I miserably failed in this case for initial 2-3 months, and then I learned something new. And once you crack the case, the cure is very fast, and the results are amazing. So that's why I wanted to share this case. So this was a female with urticaria, almost from 3.5 years. She was 35 years old. In this case, I saw long back, maybe 3 or 4 years back, and she had bad sort of urticaria every evening. This patient was taking Allegra 150 mg daily for almost 6 to 8 months when she visited me. And before that, she was taking the anti-allergic cetirizine levocet for 3 years approx. So she was taking it on a daily basis. If she doesn't take this remedy, this urticaria will be there everywhere on the body, and bad itching will happen every evening. So, she used to take this anti-allergic on a daily basis. Itching was there, slight burning was there, cold air aggravation was there. And when I asked that how did it start, what happened exactly, she said, I can't tell you that this there is some peculiar cause of it. But she said, I had fever 4 years back, nothing major. And when I asked about the past history, she said, I had typhoid in childhood. That's all. It is more in the night, itchy all over body, it is itching. Menses are regular. And when I asked about other things, so she had two issues, nothing major in pregnancies. Both the pregnancies, deliveries, everything was okay. When I asked about any stressful situation or anything, so she said, if my husband is a little dominating, and about family, I keep thinking, I just can't handle this family pressure. She was a very sensitive woman. She told me that, see, I'm very, very sensitive, very irritable, and I get hurt easily, doctor. If I feel that someone is not understanding me, for example, my husband or my in-laws or even my children, I'm very affectionate. I love them. But if they don't understand me, I am really hurt, and I weep for like very long. And that thing keeps haunting me in my mind. I keep thinking about that thing, even if it is a very slight thing, very small thing. And then when I asked her, what is that thing? What do you feel? What do you experience? She said, I feel disrespected by my in-laws. They don't respect me. And whenever something happened, they would scold me. My husband says something, even my children says something. I would feel, they're insulting me. So she feels that, insult and disrespected. I have a lot of anger issues. I'm not able to express it very easily. I get hurt with slightest of insult. थोड़ा भी किसी ने बोल दिया तो I'm like, अरे, इनको कोई तमीज ही नहीं है. So, that sort of feeling she had. If someone taunts me or says something, I would stop eating. I would stop talking. I would stop everything. So, when I tried to repertorize this case, I didn't have much of the information, only the peculiarities of the urticaria, which is more in the evening, aggravated in the cold air, and which came after fever. So, when I repertorize it, you can see that there are only three remedies which were covering like two symptoms, and most important was the apis and nux vomica. So obviously I gave apis. Nothing happened for initial maybe 1 to 2 months. She had to take the allegraph on a daily basis. There was no success. Then when I gone through her case, I gave staphysagria because she was sensitive to insults, sensitive to mortification. She was very emotional. There was pent up anger. She was irritable and things like that. So on the basis of constitutional symptoms, I prescribed staphysagria, and I was very sure, I was very confident about my prescription because I could see everything related to Ranunculacea family, the whole sensation thing, and I was like, yeah, something will happen, but unfortunately, nothing happened for 3 months, and then obviously I was anxious because for 3 months there was no change. There was not a 10% relief. So I changed the remedy. I gave Rustox because that also came very close. Then I gave the famous Artica urines for Urticaria on a therapeutics basis, but nothing happened. Then, what happened is that I was thinking about this case, and I thought, okay, retake, chalo, will again work upon it. I called this case. This was after almost like 6-7 months of me giving different remedies and trying, but nothing happened. So I asked about about the cause. I tried to explore the causation or the start of this trouble. So she told me, doctor, I cannot tell you that this started after something or that thing or this thing, but I'll tell you that I had fever 4 years back. So this problem is there from last 3.5 years. Okay. So she said I had fever 4 years back, and it was a very bad kind of, after a lot of um, I would say motivation and stimulation, she could tell us this particular thing, because I was very determined that day that I'll find out something. So she said, 4 years back, it was very bad kind of a fever. I was feeling extremely chilly with a lot of body ache for 2 days. And I took antipyretic. I took paracetamol 650 mg. Her brother is also like a homeopath, and he gave some remedy, and then she took paracetamol also, but still the fever was repetitive. Fever was there periodically. And then they went to a doctor in the village, and the doctor gave some IV injection for 2 days. After that, I had no fever, body ache was also gone, I was totally okay. And I feel that this skin trouble started after some time of this incident. So, I got something in the case. I thought, okay, this could be the start. And then I thought about this whole incident, and what I could understand is that this IV injection was some kind of, I don't know whether it was anti-malarial or some antipyretic or antibiotic or some steroid, or God knows what was it. But then I thought that what kind of fever it was. So I felt, because she was very chilly and there was a lot of body ache, it could be malaria. It could be dengue also. But I thought it was like, malaria like fever. And then I thought, let's just focus on this thing and try some new remedy. I went to repertory, and I'm showing this case to you because repertory, without repertory, I would have never cracked this case. So what was the keyword? Fever, okay, urticaria, and probably, according to me, it was malaria. So I thought, let's try. So I just went to the repertory and I searched fever after, or after suppressed fever, malaria after, and kind of thing. So when I went to skin chapter, I look at this rubrics: eruptions, urticaria after fever, okay, and after malaria, and after suppressed fever. I got only one remedy in all these two rubrics, which was elaterium. So because nothing else was working, I gave elaterium, and I was very sure this time because I got exact causation of the trouble. Okay. So elaterium 200 for 1 week. This remedy is from cucurbitaceae family. And look at the boric, what boric says. Urticaria and mental disorders coming on as a consequence of suppressed malaria. So probably this doctor, this village doctor, gave some anti-malarial drug or antipyretic. We don't know, uh, and that was the fever got suppressed, and because of that, she developed this skin trouble. So the moment I read this symptom, uh, I gave elaterium, and within 2 weeks or so, 2 weeks, 15 days, she was much, much better. No urticaria at all after 1 week. So for 1 week, she had like, infrequent urticaria. And I followed up her for almost 2 years after giving this second prescription. I gave elaterium 200 only 2 times, and there was no repetition after 2 doses, and there was no medicine required. So imagine how beautifully our repertory, gives us the gems from materia medica. So this was a very beautiful case from which I learned that you have to find out the exact symptom and then exact rubric. That is very, very important. Okay. So now let's talk about repertory, how to use repertory and how it is useful. So as we all know that the first repertory was Fragmenta Verbis Medicamentorum Positivus by Hahnemann. And imagine Hahnemann had only 99 drugs, still he needed repertory, and we have so many 4,000, 4,500 remedies, and still sometimes we do not, use repertory, which is, I feel, which is not good. So repertory is a bridge between remedy and patient. You should definitely use this bridge. In aphorism 153, Hahnemann says the more striking, singular, uncommon, and peculiar signs and symptoms of the case of the disease are chiefly and most solely to be kept in view. So when someone asks that which symptom or which rubric we should take in the repertory, so this is the answer, my friends. You have to take only striking, singular, uncommon, peculiar signs and symptoms, and not all. Whatever you get, if it is not singular, uncommon, peculiar, strange, queer symptom, it is not the symptom for you. You can leave that symptom. So just prioritize. And what should be your priority? Peculiarity. Okay, peculiarity should be the priority. So most important aspect in case taking is find out the peculiarity. Like I told you in second case, the peculiarity was that this problem started after fever. In fact, after suppressed fever, right? So finding a peculiarity is a skill, and converting it into a rubric to individualize and find the indicated remedy can actually dramatically changes the results. Like I showed you, like, for 6-7 months, I was playing with the common remedies, nothing happened. But elaterium 1-2 doses, it changed dramatically, drastically. So for example, I had this case of cough, and very, very interesting symptom. Cough more in the night, there was dryness in the throat, and voice was altered. And then the patient said, doctor, whenever I cough, I feel that heat of, like flash of a heat. I feel burning, my face is burning. So most peculiar thing in this whole slide is, obviously burning is felt on face while coughing. So when I went to the repertory, I went to face heat flushes during cough. Imagine, generally what we do, if we look at the symptoms, cough more in the night, dryness in the throat, we would directly jump on bryonia, right? Or spongia, because night aggravation is there, dryness is there, voice is altered. But when we look at such symptoms, burning felt on the face, it's very, very peculiar. We should give more importance to the peculiarity, as Hahnemann suggested. So when I saw this particular rubric, it shows us two remedies. And when I studied both remedies, petroleum seems to be perfect. So I gave petroleum and the patient become totally better. Okay. So now the question arises that how to start studying the repertory. And this is, this is basically important for beginners. Beginners doesn't mean the new practitioners. Beginner means who are beginner in repertory or trying to use repertory. So, there are some recommendations which I want to give you. First thing first is start with the basic two repertories, which are easy, so that your interest doesn't get lost. You don't feel that it's very, very difficult. It is not. Okay, it's just a myth that repertorization is a difficult thing. Practice makes the human perfect, so keep practicing. But if you are just starting, start with either Fatak or Cant or both. Okay, because Fatak is very, very easy. It's alphabetical repertory, and Cant is a basic repertory on which every other other modern repertory is being built. That's why Cant. So Fatak, if we look at Fatak, it has a lot of clinical terminologies, exact symptoms, and it's an alphabetical repertory. So plan and construction is very, very simple. You have to just jump to the alphabet and find out your rubric. But I want to talk about Kent repertory in details today, because Kent is a basic repertory which we all should learn. This is a must repertory. So Kent repertory is based on generals and mind symptoms. It has generals as well as mind symptoms. There is no generalization, because Kant was totally against Bonninghausen's idea of grand generalizing things. It's very vital to understand the idea of repertory. Because if you don't understand the plan construction idea behind repertory, you won't be able to take full advantage of that repertory. Then you will feel lost when when you're trying to search the rubric. So first, understand the idea of repertory, understand the thought process of that author behind making that repertory, and it would be far, far easier for you. And to use newer repertories, because the most of them are based on Kant's repertory, like I said. That's why knowing Kant is very, very important. And it is also important to find out the constitutional remedy. This is one of the greatest repertories ever. So when Kant made his repertory, he was not satisfied with the repertories of his time, which was mostly from, Bonninghausen, because Bonninghausen is the father of repertory. He severely criticized the faulty method of giving importance to parts, because Bonninghausen said, generalize everything, which was not Kant's idea. And as a master of materia medica, he noticed that particulars do not fall in line with generals. They are separate. So he emphasized more on generals and then going to the particulars. That's why his repertory is like from general to particular. Okay, and it's based on deductive logic, and generals are dealt with in detail, followed by particulars and then minute peculiars. So when you're using Kant, you will understand that there will be a general term first, and then the parts of it, the particulars of it. So there are 3 grades, bold 3 marks, which is first grade, obviously, which is proved by all the majority of provers, frequently confirmed and verified. Italics will be there, which contains 2 marks, and second grade symptoms, which is brought out by few provers and not confirmed and occasionally verified. And there will be simple Roman letters with 1 mark, and third grade, which is known as third grade symptom, which is verified in clinical as a clinical symptom, okay, and not as a proving symptom. It has 37 chapters, 648 medicines, and 1423 pages, just for general info. And like I said, it's from general to particular. And if you look at the sub rubrics, it has a proper, fixed pattern, which is known as STME: site, time, modalities, and extension. So first thing will be site, then time, then modality, and then extension. Now, when to use Kant? You should know when to use which repertory, because you can't use a single repertory for all the cases and multiple repertories for one case or 2 case, or different sort of cases. So when the mental and physical generals are very prominent in the case, let the case decide the repertory. It is like that. So when the mental and physical generals are very strong, you should definitely go to Kant repertory. Only for physical generals, don't use Kant repertory. If mind is strong, Kant is the best repertory for you. If you want to search something clinically, I would suggest Boric repertory or Fatak repertory. Okay. So this is how it looks. It has like 37 chapters. Now, how to find the exact rubric? Okay, and we will talk about Kant only. So first, before repertorization, you should understand that how to find out the exact rubric. So there are definite steps which I have learned over a period of time. So first thing is understand the symptom very well. You have to understand what patient is saying, okay, and just note down that and ask him. Just don't assume that whatever he is saying means this. You have to ask, what do you mean by this? Okay, let him explain. Then whatever he's saying, just note down that symptom and think about the keywords related to that symptom. Whatever keyword comes to your mind. If you don't know, you can just search the synonyms of that word. Okay, and then think about, write down the keywords if you are a beginner in the repertory game. So think about the keywords. Then choose the chapter where that keyword could be find out. Suppose you want to search hemorrhoids, so you have to go to rectum chapter. If you don't find that keyword in rectum, go to generals, go to stomach, go to abdomen. So related chapter, you have to think like that. Choose the chapter, then choose the repertory, which repertory you want to use, and choose the alphabet in case you are using alphabetical repertory. Okay. Then locate that close term which you think relates with your symptom or that keyword, and then read all the rubrics or the keywords given in that repertory and choose the most similar or the exact one. Okay, so when we don't know where that rubric is given, we have to think in this way: understand the symptom, think about the keyword, choose the chapter, go to that chapter, read all the related rubrics and find out the exact one. And once you get familiar, slowly you will be able to find out that exact rubric very quickly, because you will be familiar. If you are not, you have to follow these steps. So generally, I always say that you have to get familiar to use repertory very often. And what you can do is read 20 rubrics each day. Understand them, just note down somewhere. And detailed symptoms are there. You can refer the materia medica related to your rubrics. Read them, note them. So Kent is based on Lipte, Bell's, Charles, Bonninghausen's. Okay, if you want to use Kent, often go to each chapter, just read 20 rubrics each day and get familiar. There are some specifications like desire aversions you get in stomach chapter and not in generalities. Okay, dreams you will find in sleep. There is no different chapter for dreams, which you should know. Okay, so find out the exact rubric. That's very, very important. So I have taken some of the interesting examples for you. Um, this was a case. So this case told me that whenever doctor I go upstairs, I feel very weak, as if my legs would give out. Okay, and this happens only while going upstairs and not while walking or coming down, and I feel that they are not moving at all. This is very interesting. So I went to obviously extremities chapter, and can you see the rubric: extremities, weakness, lower limbs, ascending steps. So when someone says upstairs, you have to think what upstairs can be called else. Like, what could be the keyword associated word? Ascending, a staircase and things like that. So go to extremities, weakness. So lower limb, ascending steps, and then extremities, paralysis, knee sensation of ascending stairs. It doesn't move at all. I feel like it is not moving. That means paralysis, right? Then this is a second example. This patient said, I feel numb in the skin, and whenever I rub, I feel better. So numbness is also called as, the numbness tingling is actually called as formication. Okay, and rubbing ameliorates him. So see, I went to skin, formication, and rubbing ameliorates. And to my surprise, only one remedy, zincum, was there. Okay. So one patient came to me, he had laceration in the eardrum and he didn't want to go for the allopathic treatment. So he came to me. And look at the rubric. We have the rubric in CAN's repertory. I never expected I could find out this. So in ear, you will go to ulceration in tympanum. Okay. Tympanum ulceration, eardrum laceration. So I didn't get laceration, I got ulceration. One patient said that, I feel, doctor, all the sounds are coming from far off. It seems like it's coming from far off. See, so where will you go? Not in ear. It is a special sense. So you have to go to hearing chapter in GAN's repertory and see. Distant. Sound seems distant. But what is the keyword? Distant. So sound seems coming from distant. What an interesting rubric. One patient said, I always feel my face looks dirty, doctor, filthy. I generally, we feel that it's a delusion, that they are feeling that their face looks dirty. But Kant has given very interesting rubric for this. In the face chapter, look at this rubric: smutty. Smutty means where the skin is filthy, or he feels that it's dirty. See, This cross reference is skin filthy or smutty. One patient came to me and he had a lot of crust on the lips and very foul smelling. See, so you can go to mouth chapter also, but you won't find out anything. So when I went to face and I saw this rubric, soats on the lips. Soats means lot of crust and foul smelling crust. Very interesting rubric. Soats on the lips. Okay, one patient said, my burps are very hot, doctor. My eructations are very hot. So obviously one rubric is in the stomach chapter. It is water brush, it's like sour water coming out. But when I went to eructations, I got this rubric, eructation hot. Okay, so you just go to that keyword and read all the possible rubrics. One young patient came, young child, and he said vomiting of cough and post nasal discharge. There was a lot of post nasal discharge in vomit. So I went to stomach chapter, went to vomiting, and I found this rubric, vomiting general, drawing catarrhal plugs from posterior nares. And imagine CPI is there. I gave this young child CPR and he got totally better. Vomiting of the discharge of catarrhal plugs or which is coming from posterior nares. Very, very interesting. TB of intestine. If someone has TB of intestine, Kant has given this in abdomen chapter as tabes mesenterica, and only 24 remedies. This is the beauty of Kant's repertory, that you get a small number of remedies, and that's why it's very easy to differentiate them. One patient said, this was a patient of cancer, and he had some oozing of water or some fluid from anus while passing urine, while passing stool, every time. So when you look at Kant's repertory in rectum chapter, you don't get fluid or discharge or things like that. You get moisture. Okay, so rectum moisture. So that's all. These were some of the very, very interesting rubrics which I could find out. So many people are always confused about how to choose repertory. So this is these are some recommendations. So first thing is, if you're a beginner, if you have just started learning repertory, please start using repertory as soon as you enter into first year. Even if you are a student of homeopathy, don't wait for fourth year when repertory subject will be introduced to you. Start whenever you can, in fact today, and start with Kant, because Kant will be very easy for you. Second thing, take full case. Okay, don't stop when you get one or two very peculiar symptoms and you are very happy that up to ho gaya. Please don't do that. Take full case so that you can choose it easily, choose the rubrics, and then you can rely on the supporting symptoms as well. Understand the totality. Understand what kind of symptoms are prominent, whether they are mental symptoms or physical symptoms or peculiar or particulars or what exactly. Then choose the technique, which technique you're going with, like in the case solving, in the case taking, everything. And then choose repertory based on type of case, and not because you know one repertory or many repertories, not based on that. Don't experiment with that, but experiment with the type of case. If the type of case has the particular type of symptoms, choose that repertory. Okay, so two three things you have to keep in mind is taking full case, understanding totality, and choosing based on type of the case, type of symptoms. That would really help you. Repertory is a very important tool. Keep using it and keep learning it, and I'm sure that you will learn a lot of new rubrics and understand repertorization in this course, ORTC 2022. And I want to thank Dr. Ghansham Dalathia, ORTC team, and all the teachers and mentors. Thank you so much for giving this opportunity to me. I hope my session would be useful for you. If you have any queries, you can write to me anytime on this email, ashahomeopathic@gmail.com. And you can also visit our Instagram, Homeopathy Junction and Asha Homeopathic Academy. And feel free to write to me. Thank you so much. And once again, thanks to Dr. Ghanshyam sir. Thank you.